Okay, so good evening, everyone. Uh, we've all gathered here today to rather revisit one of our, most volatile specialities of all of dentistry, which is public health dentistry. And let's kind of see that how much scope of opportunities it basically comprises of. Okay, so I see that also there are a couple of PGs here who've joined in. Great. Okay. If you're comfortable, please switch on your videos so that I get to see some human interaction here. Otherwise, it's fine. Let's just get a knack of how do we go through this. Okay. Now, public health dentistry as a specialty is something which I would define it as dentistry for the people, of the people, and by the people. Okay, by far, I think it's the only specialty which doesn't feature or doesn't have the word "dontics" in it, but it takes in all of dentistry. And as we all know, during your undergraduation or when you encountered the specialty, you would have come across everything under the sun, including the sun, everything which is randomly asked from everywhere. In fact, I was just looking at a couple of university papers this time. Literally, anything can fit into the specialty. So how does one define the scope and how does one actually open up the opportunities in this field? To understand this, we'll have to revisit how the specialty has evolved through the years. Now, if you look at something like public health dentistry, it's not always as we know it as PhD today. That's not how it started, but rather something which was preventive and social dentistry, which started at a very small department at Government Dental College and Hospital in Bangalore. This was in the late 1970s. That's how the story began. Now, when did we arrive to this proposition that we need to give importance to the social factors of a disease? Why do we need to understand the levels of prevention? All of these things have been, I would say, like a journey of transformation through the years. So I would say public health dentistry has transformed itself from social dentistry to the concept of prevention being added later on to now as we understand the public health aspects of dental disorders. So as time advances, we see the history over the last 55, 60 years almost, we see that there's been a huge change or rather a paradigm shift in the way we perceive the specialty. And then we get to know, more and more. Okay, so I'll be sharing a couple of slides. I just thought let's just have an introduction first, and then I'd like to put in and share some content with you all. Okay. Now, I'd like to start the presentation today mainly by addressing some perspectives because you need to understand the context of any specialty before you can go on and actually find yourself in terms of what needs to be done and how do you need to position yourself. Okay, if you're looking at job opportunities in the specialty, if you're looking at where all you can apply, what's in for me if I do a master's in public health dentistry, or as many of you here are already pursuing PG, would be having a lot of questions in your mind as to how to take this forward. For that, we need to understand where the essence or the core areas, or rather the American Association of Dental Public Health defines it as the competency statements. Okay, these are basically the areas of the domains under which you will be able to foster yourself and nurture your professional endeavors in various forms of job opportunities. Okay. Now, as we start off with public health dentistry, we understand that at the core of it, it is essentially the human connection to the patient care that we provide. Okay, dental health services. So if you broadly classify and if you see how public health dentistry is evolved, it involves a lot of human interaction. Okay, as we've already seen in the camps and if you've seen in terms of research or academic pursuits, there is always a connection to patient care. So that's where a lot of counseling services come, something like a tobacco cessation counseling center, or it could be related to behavioral counseling. So a lot of humanities or human sciences is one area or domain in which you can actually work upon, after your master's or while doing master's, mainly cornering around the patient-centered care. Okay, so empathy is something which the domain is where it lies and therefore is a subsequent identity. Then there's a lot of social activity which happens here. Okay, a lot of your non-governmental organizations, or it could be related to your social responsibility. So you could end up working in community service. Okay, I'm going to give you a list of specifics much later as to what organizations you can work, but a lot of it revolves around the community consciousness or the social consciousness, where you are responsible for providing dental health care to the entire society. And then therein lies your ability to understand the differential level of services which they are already receiving. But it could be working with socially disadvantaged populations or vulnerable populations. So this is where the world is advancing, where you need to provide specialist care to these, classified populations, which is mainly in the domain of services. Then a lot of public health dentists, we are rather striving towards the equitable distribution. Okay, now all of these are the concepts which you would have read in your subject. For example, in primary healthcare, they say equitable distribution. Now, equitable, as we know, is not equal distribution of services, but we're doing to each one's ability to fend for themselves. So we have to ensure, and that is the reason why public health dentists find themselves positioned in such a way that the services are distributed on an equitable basis, and therefore you're able to meet out the affordable and accessible oral health care to various sections of the population. Then comes your concept of prevention. Okay. Now, preventive dentistry, as a whole, if you find it, it's usually associated with pediatric dentistry, right? That's just a smaller aspect of prevention, but the prevention that we deal with here in dental public health or public health dentistry is prevention of oral diseases at all levels. Okay, you could function. I would give an analogy much later describing, but right now, for your understanding, let's just assume that whether you want to be someone who's going to be interested in, let's say, mopping the floor or turning the tap. Okay, let's say if this room is filled with water and there is one root cause for the water which is coming to that room, and it's about which level you're actually operating, whether it is at the primary level of the root cause, which is turning the tap off, or you can end up mopping the floor, which is only going to make more and more scope for your work. Okay, so we believe in prevention in the truest form or sense. Okay, everybody's familiar with the age-old adage, which is prevention is better than cure. Okay, but today, if you look at the entire way dentistry is advancing forward, it's all about prevention of these dental diseases right from its root cause. So that's why we have the entire treatment planning today being done on the basis of levels of prevention. So you're technically not trying to treat a patient, or you're not trying to cure a patient, you're just preventing the disease or the condition from progressing to the next stage. So that opens up a lot of avenues for us, because we understand prevention, and then we're able to apply this for the variety of programs which are seen usually at a global and at a local basis. Then we have the concept of comprehensive dental services. Okay, let's just get this clear that we are responsible for providing all of dentistry to all of the population. Okay, so when I say comprehensive, every patient you see in your clinic or you see in your own vicinity of your practice, it has to be dealt and treated comprehensively. So once you're trained in public health dentistry, you are training yourself in preventive, promotive, and curative. Okay, so that encompasses all the specialties of dentistry. But yes, the whole idea is to provide comprehensive care. And as all of you or most of you are aware of here, you'll find the comprehensive dental centers in most of the dental colleges are all basically run and monitored by the public health dentistry department. That's because we are the ones who are particularly positioned in order to provide these comprehensive services. Okay, so that's how, because we understand the public health aspect of the condition, and therefore we're able to do the needful. Now, okay, before I can go forward, okay, let's just quickly give you some more content. Education and empowerment. Okay, there's a huge area which is related to oral health promotion, whether it is the digital side, whether it is the information, education, and communication, or IEC as we know it. A lot of organizations, everyone are looking for dental health educators to provide content, okay, on oral and public health issues. So there is a huge amount of scope for you if those of you who are creative by nature, who would like to focus and create content. So public health dentistry is very, I would say, adequately positioned in order for you to work on these areas, which is education and empowerment. So it is concerning whether it is a massive issue like fluorosis or is it oral cancer. Most of the global organizations or the World Health Organization is looking at those areas, and particularly public health dentists find a lot of opportunities in organizations which are related to these areas. Then comes your concept of integrating and collaborating. Now, if you look at the advances of dentistry, modern dentistry over the years, over the last, let's say, about 120 years, we'll see that we've always distanced ourselves away from the medical fraternity in order to specialize and to read and know more and advance more in terms of the oral health. Okay, when we refer to dental health, we're actually referring to oral health, right? But today, the world is going forward in such a way that they want us to integrate your oral health along with general health. Okay, let me give you an example. The World Health Organization recommends tackling dental diseases at a global level by putting them along with the non-communicable diseases. If you look up the action plan, if you see the WHO document, it recommends that why don't we tackle diabetes with dental caries together? Okay, there's something called a common risk factor approach, which was advocated first by Aubrey Sheeham in the publication Sheeham and Watt. If you look it up in Essentials of Dental Public Health, the textbook and the journal, you'll find that integrating your oral health with general health is going to be a very reasonable way of tackling and prevention of dental diseases. Okay, and we cannot achieve the holistic health or oral health of the patients unless we integrate and then alongside we collaborate with the organizations. Okay, if I'm looking at collaborations, it could be with multiple factors, with multiple agencies, with multiple sectors. So that opens up a lot of opportunities for you all because you're trained in principles of public health and application for the solving of dental problems. Okay, so you understand there are various dimensions of health here, and that's how the integration and the collaboration is essentially going to go forward. Okay, so there again, a lot of opportunities are opening up. Now, communication, right? As they say, many people speak, but only a few communicate. Okay, to be health communicators today is a designated job, which is usually finding its place in many organizations because they want people who can communicate effectively and push for advocacy. Okay, now advocacy is where you're pushing for the overall general interest of the population for issues. For example, let's make brushing cool again. Okay, this is how we're going to pitch it to the school children, and we want to make sure that we're going to push it. Now, this advocacy efforts can happen in a plethora of ways. Okay, we have to understand the impact and the quality of life, and therefore understand that why we need to be good communicators and need to be positioned in order to advocate for the oral health rights of the population. Okay, so there is again a lot of opportunities in relation to that as well, which kind of opens up the realm for the department as a whole. Finally, if you look at this, right, when it comes to the oral health of the public, okay, we need to understand that the policymakers, okay, the people who are in positions of power, they need to be empowered with valid information based on statistics. Okay, then we're able to work along with the dentists, who are the other specialties, our friends from other departments, with a shared understanding of all these things to overall be the bridge of how we gain importance to oral health and its relations to general health. Okay, this is exactly what we are meant to be. Okay, when I say beyond the clinical practice, this is what I mean. Okay, dentistry, all of dentistry is and will forever be clinical. Okay, that doesn't undermine the fact that I'm going to shift the focus of dentistry from the chair to, let's say, a classroom. No, I'm only bridging the gap here that all of dentistry is going to be on a one-to-one basis. Yes, but that's just the delivery or the provision of dental care. But who do you provide to? How do you plan your services? How do you ensure all the sections are sufficiently met with? That's where your dental public health comes into action. Okay, so we are looking at a slightly zoomed out approach, and then eventually we understand, we're able to achieve, the goal in terms of actual delivery of dental health services for the entire population. Now let's take a pause here and let's go back to the audience here. Okay. So this basic introduction for everybody was to contextualize where we are positioned at. Okay. Please try to understand when you're gaining a master's in public health dentistry, you are going to be trained in all of these, okay? Whether it is communication, whether it is advocacy, whether it is planning programs, policies, or working with organizations. So your area of specialization is going to be very different from the other departments, okay? In other departments, you are probably refining, you're doing more of a narrowed down approach. For better understanding, let's say if I'm talking about endo or if I'm talking about prosto or pedo, you cannot view public health dentistry in the same lens. Okay, that's only because here the specialization lies with an altogether different domain where you're going to be bringing all of dentistry to the entire population. Okay, so we need to understand first and foremost the scope part, and that's the reason why I wanted to share with all of you as of now. Okay. Now let's hear from all of you guys. What are your thoughts so far? Can we have some interaction now, guys? Yes, Omkar, how's it going so far?
I'm doing good. How are you, sir?
I'm good. I'm good. Yes. Good to see you, man. See, now this kind of like
Yes,
brings it alive. Okay, good to see you. Okay.
yes, sir.
So far, is it clear, Omkar?
Yes, sir. Yes, sir.
Okay, you're just getting the
Very much
context
clear.
of it. All right.
Yes, sir.
So I try to put in not heavy slides. I just put pictures from my camp and all of that. So let's see. Okay, we have Vishaka here. Quickly, Vishaka, can you pitch in? She is a first year postgraduate. Yes, as well. Aisha is here. Dr. Shivani. Ratish is here. Oh, hi, Ratish. Okay. Quickly say hi, guys. This is a post Diwali session, so I understand. Okay. Hi, Vishaka.
Sir,
Cool. Yes, Shivani.
how are you, sir?
Hey, I'm good. I'm good. I'm good, Vishaka. I'm good. Flag bearer of public health dentistry, so I'm just being as loud and clear and concise as possible. So yes, Ratish, good to see you, man. Okay.
So what I feel is public health dentistry is very much unknown to the people. Although many of us feel it's just a subject, but many of which मतलब बहुत सारे लोगों को पता ही नहीं है that what the public health
That
dentist
is the
is all
irony,
about.
Shivani.
So
Pata
all the undergraduate student need to have the overall view and the idea of what
correct.
it is mainly consisting of. So I
Correct.
think at UG level, it is very mandatory for the faculty people to get acquainted to the students about the public health industry and all it which all comprises, so that all can have a good idea.
Rightly told, Shivani. You know what the irony is, guys? The specialty which is responsible for creating awareness in the society has the least amount of awareness about itself. That is the irony. Okay. Students don't understand why, because they're not being told why you're taught this. See, for example, a question, let's say DCI appears in your paper. All of you have read, जो कहीं fit नहीं होता वो PhD के paper में fit कर देते. That's how it happens. So if you have a question on DCI, okay, it is a wrong indication that it becomes and makes the subject more theoretical. Okay, there's no application based questions, so it's very normal for you to not process public health dentistry at an undergraduate level. If I ask all the participants here, okay, all of you found PhD, most of them found it dry, boring, volatile. These are the adjectives that you would use. Okay, so there is a systemic problem here. Just because we don't understand the specialty doesn't mean that there is not much scope or opportunities. Okay. A lot of that awareness happens after you get into your post-graduation, when you start to figure out problem-solving techniques, when you look at journal club evaluation, then you understand the scope and the domain of the specialty encompasses so much more. Okay. I don't know how many of you here are even aware of the fact that we have a degree which has public health in it. Okay. Most of you here postgraduates, I'm sure you would not be aware that you're actually eligible to apply into any national institute which is related to dental wing. Okay, it kind of gives us the entry or the portal of entry for these organizations. How many of you know that here we can apply into the National Institute of Virology, the Tuberculosis Institute in Bangalore, or Indian Institute of Public Health and Hygiene in Calcutta? I didn't know this myself. When I went around the country after my post graduation, I was like, "Acha, ye bhi hai, wo bhi hai," and then I was like, "Acha, the degree kind of holds value because it's got public health in it." The previous generation, the seniors to us who had a preventive and community dentistry, they don't have the degrees validated or not, has broader base as we have in most of the European countries, because there the approach is public health dentistry, okay, dental public health. So this community is a smaller word, but public health dentistry is a larger word, okay. Many people have fought for this in order to make sure that we attach more value to our degree, okay. So it's good so far. I mean, you guys are having your share of thoughts, agreed. Let me just go into some more details and basics so that you'll get on with this.
Yeah, and this is sorry to interrupt you in between. So most of the students already who are participants here, they already know you. But I think that I'll just want to introduce her once so that
Uh,
anyone who does not know who Dr. Denzy is, they will just know a brief about him. So Dr. Denzy Lawrence, he is the guest speaker for us today here, and we're very grateful that he took out time from his schedule and decided to do this webinar for all the students, because this topic that he's conducting this webinar on is something that every student has a big doubt in their mind. And you've come up and started to speak about this and tell us about how public health dentistry is an equally important specialty. It itself is a very big thing. So thank you so much, sir. Dr. Denzy is an associate professor in Department of Public Health Dentistry, Bapuji Dental College and Hospital, Davangere, Karnataka. He's also the chief curator and founder of Public Health Dentistry 101, national level online learning organization for dental public health. Sir is also a creative consultant and digital marketing at CD's India, Central for Excellence in Dental Entrance Examinations. Along with that, Sir has a lot of awards and achievements in his name and numerous scientific publications, both national and international. We are super grateful, Sir, to have you today with us. And I think everyone who's a part of this webinar today can drop down all your questions, because the most enthusiastic person in the room today is Dr. Denzy, and he will answer all your questions. So, yes, over to you, sir.
Okay. Thank you so much. Lovely, Ishika. Lovely to see you transform. I've seen Ishika as a little undergraduate girl while she was here in Davangere to at the helm of a lot of responsibilities at Medi study. More power to you, girl. Thank you so much for that
Thank you,
beautiful
sir.
introduction.
Yes, sir.
So, yes, guys, moving on with the topic, which is beyond the clinical practice. See, at the outset, you must understand public health dentistry is somewhere at the intersection of public health and oral health. Okay. That's the reason why you have most of the topics or the scope only becoming broader and broader by the day. For better understanding, if you just look at the contents in your Soban Peter, which is the textbook which most of our students read, from the third and the fourth to the seventh and the eighth edition now, you'll see a lot of topics being added, which are all coming under the ambit of public health. Okay, and in a post-COVID world, rather COVID has taught us more public health than all of us can ever teach in a lifetime. We need to understand that the scope is only becoming bigger and better. Okay, I would say that the time for public health dentistry is right now, because you are poised at a very important point in time of history, because this is where there's a huge shift happening within the specialty. Okay, we have relatively a very small group of public health dentists, mainly because very few PG seats, and you're also noticing that not all the colleges have PhD as a specialty. So you are still looking at that part of the pyramid which is yet to be explored completely. Okay. Oh, I see Palak has joined. Hi, Palak. Okay. So you're having all of these things come up in the specialty. So if anyone asks you ki specialty mein scope hai kya and all these things, I would frankly say that it's an irrelevant question, because you must understand your context in the history of the department, which has evolved over the years. So it has only been, as far as I can remember, the last 10 years or so is where we're having public health dentistry being taught in its entirety with a revised curriculum in line with the global standards. Okay, so if you're looking at opportunities abroad, okay, let me give you a perspective here. Public health dentistry is called as PhD or public health dentistry in American context, where you have an American association, and they have a residency program in DPH, which is dental public health. And as far as I know, there are only about 150 or 160 trained dental public health dentists for the entire United States. Okay, even now there's a 2-year residency program, or something of which I had applied soon after my PG, but it required me to go there, so I ended up staying back here. But once I figured it out, I got to know that yes, we are still looking at the entire possibility. This is a mountain of possibilities there because they require a community dentist literally for every wellness center set up across the country. So if you look at the United States Department of Health and Human Services, there is I wouldn't even say an acute, there's a chronic shortage for people who are trained in public health principles. Let me give you a context of Europe. Okay, if you look at Europe, if you look at the UK's model, okay, which is what we want to emulate in our country, the NHS. Okay, the NHS. If you're looking at going abroad, the NHS is what almost literally controls 95 to 98% of dentistry in the UK. Okay, and there most of them are appointed because there is a payment system which is related to a capitation fund and then a list of ABCD services being provided to the population. So they hire community dentists primarily over any other kind of specialty because they want people who can understand concepts of nutrition, who understand epidemiology, who know basic amount of biostatistics. So this is what we've been trained for. Okay, and as they say, right, unless you know the why of something, you are not convinced or you're not motivated enough to know the what, where, how, and all of these things. Okay, so like I said, we need to revisit and understand the context of the specialty and then figure it out. Okay, let me give you a context of the Middle East. I don't know how many of you here are looking to go to the Middle East. There, if you understand, the highest amount of credit points, there's an entire program which is focusing on community services. For example, the school oral health program in Kuwait, okay, or in Oman, or in the Emirates. They specifically hire specialists for the provision of services, and they hire a community dentist who's going to manage the entire program. So you understand the kind of administrative roles which you're opening up yourself, and the administrative roles are paid far better than one who is just doing the restorative care or the prosthetic care or the endodontic care. Okay, globally, public health dentists are placed higher than most of the other specialties. Okay, because that's how dentistry is meant to be. Okay, it is meant to be provided for the entire population as a whole. Then coming much closer back in our country, okay, the reason here, we all know, okay, not much has been told or spoken about public health dentistry as to why you're reading this, what is the purpose, where can you apply. All of this happens because none of the previous generation, I have nothing against them, but I believe that they've done a huge disservice to the specialty by not pitching the specialty with all its spirit to the undergraduates, because you've just been told to study or read these things and not been told that why you're doing all these things. Okay, for example, if you look at research domain, okay, the fundamental way of how you conduct research in whichever specialty is based upon the fundamentals of research designs. Okay, and that is what public health dentists are trained for. You understand, here you are focusing and you're putting yourself into automatically the n number of journals, how you could be reviewers, you could be editors, and you could be doing so much of part-time work while sitting at your clinics, only because you've got a superior knowledge about research methodology and biostatistics, and you can make a lot of money only by biostatistics consultation. Okay, why I'm telling you these things is I don't believe in preaching. Okay, I only want to teach all of you that how you can position yourself by just taking out one part of the specialty. And I'm not even going to the rest of it. I'm just talking about the biostatistics and the research methodology. And many of my friends are doing this. Okay, they are comfortably placed in their clinics. They're doing their general practice. They're also working as editors and reviewers, for which they paid handsomely. They're also doing biostatistic consultation because they understand research results. So every department, everyone is running to them in order to provide, how to work with SPSS, how to work with your statistical, test which needs to be applied, which is the fundamentals for any department. Okay, so you understand what you're opening up for yourself. Okay, that is in fact the scope. Then when I come to certain areas, like I told you, most of the national institutes, governmental organizations, and we are on the brink of having the national oral health policy. Even if it were to be implemented, if the government implements the national oral health policy as of now, we adopted it in spirit. Okay, once we actually implement it across the country, for a country of 140 crore population, okay, you're looking at easily about 6,000 districts. Okay, there will be a post which will start off with a master's or a master's MDS in public health dentistry. Even if I say one post for every district, which is going to eventually happen, it's already started in a couple of states, you don't have enough public health dentists to fill up the vacancies. As of now, we are a trained body, as far as I know, to the best of my knowledge, about 3,000 public health dentists in total for the entire country. So if you're thinking that there's already saturation, we've not even reached anything even close, let's say to say 10% or 20% of the entire jar here. Okay. So like I said, even if you were to implement the policy tomorrow, we don't have enough trained public health dentists because we are a country of such massive population with impending oral health needs. Okay. And the best part, okay, this is the best part, and I always keep the best for the last. You can do all that I said in the last 30-40 minutes. You could work as communicators, you could create designs for global organizations, you could work as comprehensive services in MDUs, you can work as academicians, researchers, statistical consultants, all of this apart from having a booming general practice. Okay, so nobody's stopping you from starting your own practice, working according to your own convenience, having your own, I always say that public health dentistry allows you to take dentistry along with you wherever you go. Because remember, you don't have Dontics here. Okay, you're not working with only orthodontic tooth movement, or you're not working with only the pediatric aspect or the endo or the prosthetics. Okay, you're working with requirements of everybody, and everyone have got multitude of requirements. Okay, so if you look at most of the public health dentists, I'll give you a very classic example. Okay. Dr. Parthasarthi Reddy, okay, he's a public health dentist of a senior generation, and he runs by far, I think, in Hyderabad. If you all have heard of this chain of clinics called FMS Dental, okay, they have close to about, I think, 13 or 14 clinics in Hyderabad, in Telangana, in Andhra Pradesh. They have another one in Kochi. They have everything. Everything is run and managed by public health dentists. Why? Because we just get people, we get their requirements because we are on a one-to-one basis investing in real people and the real concerns of them. So if you're thinking, if I should do masters in public health dentistry, it's only going to make you a better clinician. It's going to make you better at understanding the needs of the patient and then providing it with a specialist of services. So I can proudly say that public health dentists today are occupying the highest of posts. Tobacco cessation centers today are there in every dental college, and we know that we're dealing with a scourge of oral cancer. So the government takes the National Oral Cancer Prevention Program very seriously. So there's a lot of counseling directed efforts there. There are many of my juniors and friends, and all of them, I can give out specifics to who wants later on. They are working in tobacco projects alone. Okay, they're working with the International Union of the Lung and Diseases Prevention Board, and they're working as junior research and senior research and Project A and Project B scientists. So if you look at most of the All India Institute of Medical Sciences or PGI Chandigarh, there are areas and domains where public health dentists are actually working on long-term epidemiological research. So you understand that you are putting yourself into, so many possible areas. And I always say that, most of my students in class, I tell them that PhD has got something for everyone. Okay. If you're someone who wants to, just work on clinical practice, you can expand your clinical practice to unfound, proportions and heights. Only because you have a master's in public health dentistry, it makes you really good with people. You know how to mobilize the patients to your clinics. And today you find the best of the practice across the country are people with a degree in public health dentistry or community dentistry. Okay, to such an extent that I will proudly say that public health dentists also run colleges in this country. Okay, I was talking about Dr. P.P. Reddy, right, who's from Hyderabad. He runs his own dental college, which is called Sri Sai College of Dental Surgery in Vikarabad. Okay, that's only because he says that he learns his administrative skills from his PG days. So you are only limiting yourself, guys. Okay, you need to look within yourself, understand that what are you good at, work towards it, arrive at a niche area post your MDS and work on these areas. Okay, I never enshrine that I would be working in social media, I would be working in digital marketing, what I do for CDs, what do I do for my institution, or all these things. It's only because it made me capable enough only because of the training I received during my post-graduation. Okay, so public health dentistry is like, how do I put it? It's like that extensive thali which is in front of you with bahut sare items. And if you're someone who would like to have different stuff and variety and a la carte kind of experience, this is the specialty for you, and you need to work along those areas and then find your niche areas. Okay, all right. So let's just pause here for a minute. Let's hear. Okay, hi, Palak is here. Palak, and then Aisha and Mickey. Who's Mickey? I'm a little curious now. Yes, Mickey. Is that what you want to be referred as? Okay, let's hear from Ratish. Hi, Ratish.
Hi, sir. Sir.
Okay. I have a question for Ratish.
Yes, sir.
Why did you take up public health dentistry, man?
First of all, thank you for you, sir. You have been an inspiration for me to take public health dentist. To the other guys, sir is like an ambassador of PhD all over India as well. First, I'm one of the PGs in PhD who took PhD by choice and not by chance.
Okay.
That is because like PhD is, as sir said, it is like a huge tally. It is like an ocean. More than what you see in UG days, it is not even just a drop of water from that huge ocean. So if you are like, if you want various options after dentistry, may it be like corporate sector, may it be a clinical side, you can be a social media influencer, as sir said. So PhD gives everything what you want. And as most of them quote that PhD is a non-clinical branch, which is wrong from my opinion. PhD, you have maximum hands-on on patients as well. So even that becomes an addition to your MDS as well. So yes, sir. This is
rightly said. That's a very valid point, Ratish. What you mentioned here. No, nothing in dentistry is non-clinical, guys. We start working on patients in our third year undergraduation. Okay, so you must understand the evolution of dentistry is very different from how medical sciences have evolved. Okay, medical sciences still they have classification like non-clinical. Okay, unfortunately the same thing is applied here, and they've classified oral medicine or community or anything as non-clinical. Okay, all of dentistry is clinical. The evolution of specialty in dentistry is more based upon advances in dentistry. Okay, because there was more advances in restorative care, today we have conservative dentistry. Okay, we are focusing on children, exclusive dental needs of them. So we have a pediatric specialty. We're focusing on tooth movement and dentofacial anomalies. We have orthodontics and dentofacial orthopedics. So you must understand the evolution from dentistry as a department or a specialty to all of these. In the same way, public health dentistry encompasses all these aspects because principally, if you look at P&SM, which is our counterpart in the medical fraternity, they don't have any amount of patient examination. Okay, but we, on the other hand, what we examine patients in the clinic, we go and do it in the community. And that is why we say in PhD, the community is referred as a whole. Okay, but dentistry is never going to be non-clinical because it involves examining of the patient. Next, when you examine 10, 15, 100 patients, then you kind of make sense of the data. There comes epidemiology. Okay, today I'll give you a simple example. Okay, all of us have been throttled with this definition of dental caries in our first and second year of undergraduation, which said that it is an infectious microbial blah blah nonsense, right? From understanding that dental caries as an infection, today we've changed the definition and we refer it as a multifactorial disease, because we understand even if there's S mutants, there's a host, there's an agent. Dental caries does not happen across a period of time in some patients. So you must understand the nature or the natural history of disease is very different. And in dentistry, name one disease which is not preventable. Okay, the concept of prevention is more applicable in dentistry as compared to any other infectious diseases. That's the reason why the World Health Organization says, please tackle dental diseases along with non-communicable diseases. So when I say non-communicable diseases, there comes your risk factors, your risk determinants, your risk assessment. So you're finding avenues like there's so many advances in public health dentistry where we have so many modern techniques. AI is coming up, how you can do caries risk assessment. Like, guys, there's a huge amount of information there, all right? And the world is moving so rapidly fast that today we're having, with the help of AI, we're having a lot of models which are being developed for periodontal risk assessment or caries risk assessment or for prediction of oral cancer and all of these things. So it's public health dentists who are trained in information analytics, who are trained in data surveillance, who are trained in health information communications, they are the ones who get a better understanding of this. So you look at the future, how it's going to come up in future going, because dentistry is going to affect people more in terms of their quality of life. So there will be concerted efforts for you to identify what needs to be done at which part of the pyramid. Okay, so don't visualize public health dentistry as a department restricted to, let's say, a college or just conducting camps and all. No, the scope is far beyond that. Okay, you'll have to understand it in that sense, and that is why we are reading what we do. Okay, so especially in these lines, and I just want to conclude on a couple of remarks towards the end here is all the scope and opportunities for you. Is all dependent upon what areas of skill set you work upon. Okay, during your post-graduation, since most of you here are PGs, focus on your communications, you can find a job there. Okay, focus on your advocacy with the digital content creation, you can develop and create. Most of our models and posters and everything is going there. Okay, I've had students who have developed apps for the departments. Okay, public health dentistry functioning as an application becomes the source of the window for all of the dentistry. Okay, the government of India is working. There's a resource center which is headed by Maulana Azad. They are developing material particularly for ASHA workers or could be school teachers. You kind of understand the kind of scope which you're looking here at. It's a huge world out. When I started PhD 101, okay, the whole idea was to convey this message in a easy and a very understandable, comprehensible manner. Okay, so let's just try to dissect the specialty, and like I said, creating more awareness in that realm. Okay, so yes, I didn't want to go too far. Let me just take some thoughts from the audience. Yeah, Krish, who's Krish here? Hi, Krish. I hope this guys. I mean, you can use the chat box instead, guys, if you're wanting to ask anything specific. I thought we'll have some time for Q&A. Yes, any doubts? Omkar, go ahead. I think you can tell us, exchange how you visualize the department.
I wanted to ask, sir, what do you see the role of public health dentist in tobacco prevention? Because tobacco prevention has been going on since decades and decades, and still the amount of cases that we see in today's scenario, cancer cases and the oral potential malignant disorders. So what role or what specific role we as a public health dentist should play in tobacco prevention?
Okay, that's a very valid question, Omkar. Now, when it comes to tobacco cessation, okay, somewhere we are not working towards the advocacy and lobbying efforts where we can have a ban on tobacco. The problem is the tobacco lobby is so strong, in the garb of having marketed itself as a cash crop and a commercial crop. I'll give you a very simple case study. Okay, Philip Morris International is the parent company for all the fancy cigarettes that you see in the market. Okay, whether it's Marlboro to your this and that. They've been so smart and clever around your plain packaging that they manufacture and they grow their tobacco somewhere in Africa, they package it in Indonesia, and they sell it in Australia and India like this. Okay, so you must understand that you're dealing with a monster, which is tobacco. Okay, only awareness activities are not going to help solve the problem. That is the reason why, to start off with, if you look at the TCC Center, it does focus a lot on the counseling, your 5 A's and 5 R's and all of that theory part, but focusing on counseling. Okay, there you have to focus on efforts in the media. Okay, your Mukesh or your ads, which are not going to work because people have kind of become insensitive to that, and in spite of knowing something which is bad for them, they have to be told to quit the habit. So you're dealing with the psychological problem, you're dealing with a social practice which is very deeply rooted for centuries. Okay, smoking in various forms, smokeless and smoke-free type of tobacco, is in the society for a very long time. So countering all these efforts at multiple levels, it is usually recommended to go with an upstream, midstream, and a downstream approach. Okay, so you have to suggest and come up with recommendations alongside like this. Okay, so to begin with, we have to do a lot to do with the endorsement of tobacco. Okay, we need to have celebrities not endorse tobacco so that they are doing it at a national level. We have to make sure on your drives and campaigns and focusing on areas where you make smoking uncool. Okay, you make it very uncool, and particularly bring about a behavioral or a psychological change in the minds of the population, and then more awareness. Again, I'm not talking about grandmother's advice that tobacco is bad for you. No, we need to narrow it down and make it very specific. Okay, NIMANS recently has conducted a lot of work on how we have to revise the IEC material for tobacco cessation. Okay, so this is International Union for Lung and diseases of related to tobacco. They've been doing a lot of amazing work in this area. They've been having, overall, if you see the CATS survey which came out, actually has shown a decline in the tobacco trend globally, because now it is socially not that acceptable. There's a lot of prohibition on it, so it kind of curbs it down. But then, like they say, over the years, you are facing with newer challenges. So there's a lot of scope of work to be done in realm of tobacco. So that would be my thoughts on that. Okay. Yes. Does Shivani have anything? You want to ask anything? Vishaka, anybody? Ratish, go on.
Yes, sir.
Yes, Shivani, please.
I just want to ask, if somebody is trying to settle down abroad, so how can be the initial step from the public health point of view, so that you can step out of the country and do something innovative or something else which is very much trending right now in the other countries and which we are not aware of,
Okay, now let me just, I hope I've understood this question correctly. You want to work as a public health dentist abroad?
Yes, sir.
Okay, fine. Now, to begin with, there are certain statutory requirements. It requires you to do a specialization in dental public health or public health dentistry, which is a residency program. So they want you to work with their population with different ethnicities. So public health dentistry, if you're trained in India, would be applicable to similar countries, maybe Southeast Asian countries. So there you have the degree being accepted, recognized, and then you apply for it. For example, most of the Southeast Asian countries like Malaysia and Indonesia, that's where Indians, with our understanding of social factors, with masters in public health dentistry, are able to get into directly where the degrees are recognized. However, if you're looking at countries like United States, they have America is a melting pot of cultures. It's different social factors there. Socioeconomic status is different. The distribution of diseases there, it's based on the ethnic and the racial variations. So they want you to do a 2-year residency program that is after your basic DDS. Again, you'll have to follow the stipulated guidelines. So if you're looking at different countries, it's going to keep varying like that. But overall, like I say, World Health Organization itself says for public health dentistry or dental public health that you need to think global, but you need to act local. Okay, you have to devise strategies for your place, for your locality. Okay, so if you are, let's say, working in a metropolis like Bangalore or Mumbai or Delhi, or you're working in a place like Davangere where I am right now, so like this, you'll have to map the social factors, find local organizations, and then suit yourself there. Okay, there's no one degree which will give you universal acceptance across the world. It doesn't apply to dentistry. It doesn't apply to public health dentistry also. Okay, so I can give you specific details if you reach out to me specifically with respect to countries.
Yes, sir. Thank you, sir.
All right. Yes. Any other questions?
Hello, sir. Sir,
Yeah.
I wanted to know, so there are many organizations apart from dental institutions like NIMHANS, many other corporate jobs which are working for public. So how we can join with them and how we can get to know what are the other programs which are currently there and how we can enroll for it, sir?
Got it. See, now when it comes to applying in the governmental sector, okay, be it any medical college with a dental wing, or it could be dental specialty in corporate hospitals or in the district level. For example, the position of a dentist. As of now, the government, if I say, for example, in Karnataka, the post of dentistry starts only from a community healthcare center, from a CHC. Okay, so from a CHC, you have a dental officer who is earmarked as a BDS or a dental surgeon or dental health officer. And then in the district hospital, you have a senior dental health officer. In bracket, it could be an MDS in any of the departments. Okay, we need the government to acknowledge and understand that the post of a dental surgeon at a district level should be given preference to a public health dentist, because it's going to be a public health dentist who will understand programs better at a district level. Okay, unfortunately, right now, the medical fraternity themselves don't know whom to hire at which level and position. Okay, then there are various institutes, you have to club it. There are government publications. Okay, there are listings on the Press Information Bureau, and all of these national institutes, they have their own websites where they open up dental posts. Okay, many of them are surprisingly, when they go for interviews, and me and my juniors and a couple of my friends, when we appeared for interviews, they were actually shocked, or rather they were not aware that we have a dentist who's trained in public health. Okay, so their lack of awareness, it isn't their mistake. Okay, so when you apply into National Institute, let's say when you go to an AIMS Bhopal or an AIMS New Delhi for a dental post, which is only an MDS post, you go there in the interview, they understand that you coming from the public health background, automatically you get preferred. All of these are listed on the department websites. Okay, and the dental wings separately, today you have a lot of groups on WhatsApp, on Telegram channels, everywhere, where you're always looking for government positions. Okay, in government positions, if you can communicate well, if you make sure your publications are in place, and you answer your interview with confidence and clearly communicate that you're someone with a background of dentistry and public health principles, automatically you have posts which are there as epidemiological surveillance officer, non-communicable disease programs, and so much more. Okay, literally every government hospital, every district hospital, you just have to do the networking where you're looking for in your state or in your city. Okay, today everything is available online because all the governmental listings have to compulsorily be put online. Okay, so you just have to check, spend some valuable time online, look into the websites of these national institutes, look at the gazettes, look at the notifications which are given. Okay, unfortunately, we don't have a portal of everything which is organized by the government, because health is a state subject. The problem is, if there's a vacancy open in Bihar and if there's a vacancy open in Karnataka state, they don't necessarily have to communicate for dentists to hire. Okay, that's because health is a state subject, and they say that you devise your post, you devise your positions, whether it's tackling medical issues or dental issues, based upon your need and requirements. So that's how it functions.
Okay, sir. Thank you, sir.
Okay. All right. So do we have any other questions, guys?
Sir, I just want to ask you, if say suppose I'm pursuing MDS, but I just want to do some extra kind of courses such as in biostats or anything else.
Yes.
So can you recommend me some like authentic and very like essential ones which are needed to know by every public health dentist to do?
Okay. Okay, Shivani. Now you're looking at some add-ons, right? Like you're having extra cheese, you want to have extra lettuce and extra fries, correct, to your meal?
Yes,
Okay.
sir. Yes, sir.
Okay. Now, if you're interested in, let's say, biostatistics, okay, you want to start professional consultation, then there is a very fantastic course by CMC Vellore in biostatistics. I think it's a 2-week or a 3-week course where you go, stay in the campus, work for, you're put into study groups, you enroll for yourself, and then you get a PG diploma, you get a PG certificate course, which is given by the CMC Vellore organization, which is of very high standards. Similarly, if you want to do in a sociological behavioral counseling or tobacco cessation, you can always apply, go to NIMANS. They have a PG course, diploma course. You can enroll for it. It's like a 3-month or 6-month where you work with patients, you're doing counseling, you're treating with nicotine replacements. So they are the premier institutes to do that. Then there's also Tata Institute of Social Sciences in Mumbai, which gives you PG certificate courses among various, public health disciplines. If you're looking at something like epidemiology only, again, you want to do an add-on course. Pune is very fantastic for it. Symbiosis. Ramaya gives you another very good, fantastic course on epidemiology because they have separate health systems. Okay. Very recently, I discovered that JSS Mysore, JSS Academy Mysore has got a health systems research unit. Okay, they have specific PG diploma courses from 3 months to 6 months to a year to 2 years, which you can do after your MDS, only related to health systems and transcript management. Okay, so you're talking about systems management, talking about surveillance, health informatics, all of that is available. Okay, so based upon your area of interest, you can always do your add-ons. If you're looking at your region, I can definitely look it up and tell you, but these were the top of my mind.
Thank you, sir.
Yeah. Okay, so yeah, are we running out of time, Palak? Give me a heads up on that. The host who's managing the meeting.
No, sir, we are not. We are not. Absolutely not.
Is it? Okay. Any more questions, guys? No, I don't want to bug everybody, too much, because this is it shouldn't be too much of information altogether at once. So that's the reason I was like keeping it slow. Okay. Okay. Any other questions, guys? You want to ask specifically?
What are the add-ons which you can recommend while doing PG courses? While doing PG?
See, while doing PG, many of these online courses are available. Manipal gives you options. Many of your hospitals give you hospital administration, healthcare administration, where you require to go for a couple of community visits and prepare reports. And you could also work on your digital skills, because information making, infographics, the World Health Organization, CDC, AIMS, New Delhi, your National Resource for Open Center, National Center for Dental Health Resources, which is headed in Maulana Azad. They give out a lot of add-on courses. So you just have to look up into that based on your area of interest. You can pick up anything now. You can go from epidemiology to administration, which can be done during PG, biostatistics, healthcare management, biomedical waste management. You can focus on ethics. You have open universities. IGNOU gives you like a medical ethics course, or you can also focus on jurisprudence. See, everything in your simple textbook of Sobhan Peter, all the subsections, right? They all have add-on courses. Okay, specifically you can identify, shortlist, consult a couple of people related to this, and then I can suggest, if you're looking at this, you can go there. That's the best part of our specialty, right? It is the specialty of specialties. It gives you so many portals of entry into so many areas, diverse areas, where you can juggle between them. You can manage multiple, you can schedule them, and you can take your beautiful dentistry along with you wherever you go. Okay, so that's the reason why public health dentistry is very awesome and really cool as a specialty. Okay, I hope I have answered that, Omkar.
Yes, sir. Yes, sir.
Okay, Ratish has any thing to share? Anything y'all have? Please share what anything interesting y'all have come across, public health dentistry, public health dentists.
Yes, as you said, PhD is really vast. You have openings every year. I just recently came across a public health dentist over here in Chennai. He was recently posted in WHO under the oral health scheme in South Africa, sir. So he's really working over there, like promoting health education over there. His role is just to teach brushing method all over the South African population.
Yes.
So true. One thing I came up with.
There are many projects like this, Ratish, which happens in Philippines, happens in Korea, which happens in African nations. See, every country is concerned about its oral health of its population. So they have chota mota programs which are there. They require project managers and they're ready to pay in US dollars. You can go stay for 6 months, a year, 2 years, learn hands-on, do your ARTs, do your sealants. Like you can go to, I told you example of Kuwait. They have a very well-structured school holder program. Okay, so you can find and squeeze in your head in virtually any dental program across running in any part of the country. As long as the logistics are favorable for you, you get a good deal with the pay and with the holistic experience. You can always go for dental projects across the world. Okay, and let's say, for example, in the UK, okay, if you will, let's say, specialized, I had a student of mine, like she did an MSc in tropical medicine, like after her BDS, she ended up working particularly on tropical diseases. Okay, she did an internship, and she had a paid internship. She got to do it in Kenya, I think in Namibia, and most of these Central African countries. And then she's come back now. She's working with an NGO in Chhattisgarh. All of this, even without, and she said, "Sir, I wish I did an MDS in public health dentistry," because back then she wasn't not really that much convinced. But then eventually she's come back now, and she's like, "I'm just applying the principles of public health." Okay, and let's just understand this, guys. Nothing is more universal than health and disease. Okay, I'll repeat. Nothing is more universal than health and disease. Okay, if you're all healthy, we're all healthy together. If you're all diseased, we're all diseased at some stage together. Okay, so there's a universality which happens here, and that is the reason why public health dentistry is never going to extinguish itself. Okay, as long as people will have teeth, they will continue to use it. There will be societal factors. There will be consumption patterns. There will be the scourge of dental caries, periodontal disease, oral cancer, malocclusion, fluorosis. All that is going to stay. Okay, it's how we mitigate and we solve the crisis and provide services to an entire population. So like that way, public health dentistry can literally brazenly get into any of the departments and just make it only better and better. And the best part is none of the other specialties feel threatened by us, because we're not going to fight for their chunk of the practice. Okay, their chunk of the practice is going to be in areas which are narrowed down. Okay, whether it is endodontics or pedo or prosto or ortho or endo, all of these things, we are just going to better, or rather their prospects, and make it even flourish in a more purposeful way. Okay, so many public health dentists act as consultants related to running of clinics. Like I myself, I help a lot of clinics brand better, market better, advertise better in terms of whatever is allowable, and positioning, and get more patients, get more databases, equipped with a lot of technology. So I'm just working with a couple of clinics, and my hands are already full because I'm not able to manage more, because that's the kind of scope you open up for yourself. Okay, so public health dentists are very, very good public health managers, and that only our friends from other departments would be happy to have us on board, as long as you add value to your work. That's it. Okay, cool. All right, I think you have anything else, guys? If all your questions are, I mean, of course, this is just the beginning of the learning curve. I'm always going to be available for you guys. Okay. Yes, Ishika, I think we're good to go now. Okay, I'm still curious who is Krish and Mickey. Is it just like, just joined and then disappeared, guys? Okay. All right, guys, I think, can we have your cameras on? Let's have a quick picture together, all of us. Omkar, Vishaka, Ratish. I'm just going to take a screenshot, and we need to spread modes here. Smile while you still can. Omkar is where? In which college are you right now?
In Shagan Dental College, Pune. Vinith Sir department.
Yeah, you're in Pune. Ratish is in
Karpaga.
Karpaga, right? Vishaka is in RV,
Yes,
correct? I know. Okay, just a minute.
I'm Ankit, sir.
Yes, correct. Multi-speaker view. Okay, let me put the gallery view. Okay. All right. Say cheese, butter, and whatever. Smile as much as you can while I take a screenshot. Yes, Ratish. Okay. Okay, nice. Thank you, guys. Thank you for joining in, spending your time. I hope this was helpful. Please, your feedback quickly. If you can take a couple of minutes and just list out how was the session for you all, and was it like helpful, and in what sense? Let's start with Omkar. You can.
So very much helpful, to be honest. I've been waiting to attend this kind of a session since very long time. because being an interest in public health has been one of my key factors joining public health dentistry. And beyond clinics is more important because we always do clinical stuff in the department, comprehensive cases, attending camps. But to figure it out, what is beyond clinics, what kind of aspects open us to us, what kind of opportunities are there for us, it's very much important. That I think we all of us have understood from your lecture, sir. When we wish to have some more lectures from you in future as well.
Thank you, Omkar. It was always beyond the clinics, because as they say, clinics and communities. This is where all of public health dentistry lies. Okay, so beyond the clinics, I think it's about reaching out to the communities. Thank you, Omkar. Yes, Ratish, how is it for you? Any inputs you want to share?
Yes, it was a great session. As usual, you are inspiring still more people. Yes, a lot more sessions like this would be really helpful to connect with you and more PGs as well. And we can talk on what is the current thing going on among the PhD, other than a conferences and convention. Like this small sessions, mid times will be really helpful, sir. Thank you, sir.
Surely, man, surely. Since this was the beginning of the series, I do have a lot of content, specifically, like I said, specific job listings where you can apply. It's like an extensive, long course. Like by the time you finish PG, like you should be clear where you're going to apply, what you're going to do, and you need that much needed guidance, right? Unfortunately, I didn't have that when I finished my PG, but that's when I was determined enough to realize that, okay, I'm going to make sure this is going to be available for my students so that it saves a lot of time, man. It saves a lot of time. So what I figured out anecdotally is something which I want to share with you all. So thank you, Ratish, for your thoughts. Yeah.
Yes, sir. Thank you.
Sir, it was a really good session. Actually, being your student in UG times and then having a conversation with you and me saying each and every doubt of mine to you. And this session actually got us have a connectivity with other PGs. What is their perspective? What they are thinking currently? How public health dentistry is? What are the recent trends? What are the different job opportunity for us after completing our MDS course? So like having this kind of conversation seminars, it would be like helpful for us even in future also, sir.
Okay, that's nice to know that you've started well, Vishaka. Like since I've seen and I've mentored you right from your UG days, you always had the potential. Again, like I say, don't fish in the dark, guys. Okay, even if you're fishing in the ocean, there is a place where there's more likelihood for you to catch the fish, right? So it's never going to be randomly looking for opportunities. It doesn't work like that. Okay, you have to have some guidelines. You have to have some pointers. You need to network, guys. Please network. See, you could get certain perspectives from someone like me who's figured it out in my own way. Okay, you'll find many more people who have done different sorts of things, and I would recommend you guys look for examples of people who are not very senior to you, because the environment and the dynamics have changed. Okay, till about 10 years ago, public health dentistry used to be taken because it gives you a comfortable teaching job. Today, we've come to terms with the reality that there are no jobs in any colleges. That's not what it is meant for. Okay, just because it was like a misnomer kind of thing that PhD was opened up in many departments, a lot of colleges had opened up. There was a huge demand for PhD faculty. So many of our seniors didn't need to look beyond the obvious. They got well-paid jobs, they got good salaries, they got visiting opportunities. So they've done peace with their existence. Okay, we have to figure out our opportunities by understanding and what is in our side, the specialties on our side. Okay, once we understand the scope in its entirety, the opportunities in its real sense, then I think you can position yourself financially. You can, be very confident and in a very comfortable position. You can know how to do justice, and above all, why are we in the specialty for? Okay, that kind of sense of fulfillment and contentment which comes is very superior as compared to any other department. Okay, because here you're not impacting just a person, you're impacting, even if it's a small cohort, it is a community of people. Okay, so whether it's counseling, whether it's behavior modification, whether it is a serine program, whether it is a fluoride application, you are still reaching out to more people. So that's technically, reaching out to more than any other department of specialty. So let's take it beyond the clinics. Let's take it to the communities. Let's understand the realm of possibilities, is how I put it, which public health dentistry comes. And above all, it's a responsibility. Okay, it's a responsibility because पेशेंट है इसलिए डॉक्टर है, डॉक्टर की वजह से पेशेंट नहीं है. तो डेंटिस्ट्री हैज टू फंक्शन एसेंशियली if it's affordable, if it's accessible, then only it's applicable. Okay, so that is why, however old-fashioned it might sound, these are principally the fundamental concepts on which the specialty is built. So all the best to you guys. Reach out to me, anything you need, specific assistance, whatever it may be during your PG, what opportunities, what are your niche areas, what are your areas of interest. Okay, based on that, I can give a personalized mentorship program for you all and suggest you where to apply, how do you position yourself, and how do you propel. Okay, and in the end, yours be the world and everything else in it. So thank you so much, guys. Thank you.